Hi, I'm Dr. Brouse, and I know some of you are sitting there right now wondering, why do you have to watch this video? But I can tell you one of the biggest reasons we have such high success rates in our office is people truly understand what's going on with them. Whether you had a condition start yesterday or whether something's been going on year after year, I know a lot of you have been pretty frustrated when you came in. You've been to other doctors, you've been to other chiropractors, you've tried different medications, but you haven't got the results you're looking for. So in this video, I'm going to help you understand exactly what the problem is, what's causing it, and let's find a solution so we can get you better and you get your health back on track.
I want to go over some basic anatomy so you can help you understand exactly how the body works and how the body functions and how the body heals. When God designed this amazing structure, He put the brain inside our head, and it runs every organ, every cell, every tissue in the body 100%. At the bottom of the brain is a spinal cord, and it connects to all the organs. In order for your heart to beat, your lungs to breathe, your stomach to digest, or your prostate to function, the brain must be able to communicate to those organs and also receive messages back from those organs. The problem is science discovered when those areas get compromised, or you have an injury or something happens, they call it a subluxation. It's where the nerve literally gets choked off. And they found the pressure of a dime can shut off that nerve function by 60%. And when that happens, your body can go downhill. And they found there's a lot of things we do during the day that can contribute to subluxations, like sleeping wrong, computer, being born, maybe accidents. The new thing with kids are they're on the phones all day long, so their head's wrenched down. And these subluxations, I kind of think, are kind of like a cell phone that's got a weak signal. The messages are getting through, but they're not getting through the whole way they should. So over time, your body can lead to disease and dysfunction. It's also like a hose that's getting crimped off. So if somebody gets subluxated and nerves go to the heart, what's going to happen to the heart? It's not going to function the way that it should. It can lead to heart disease or high blood pressure. It's going to lead to somebody taking probably many medications. Subluxation here can affect how the lungs work or affect how the stomach can digest. Or down low could affect the prostate. It could affect it developing abnormal cells, aka cancer. So your body, if it doesn't know those cells are happening, how can it fight them off? Is there any drug, vitamin, exercise, or stretch that's going to fix that? Absolutely not. And the challenge is a lot of times we're subluxated and we don't know it because only 10% of the nervous system perceives pain. 90% is function. 90% is making the body work the way that it should. So in order to be healthy, we need a 100% functioning nervous system. This is the main reasons we have so many people that are in wellness care, getting regularly checked. I've been adjusting my kids since they've been born.
When we look at your spine in a minute, we want to see that it's nice and straight. We don't want to see a spine like this. The spine will start wearing out. We look at it from the side. We don't want to see a straight one. We want to see curves in it. We want to see the curve down here, or curve in the middle, and a nice curve in the neck. If these curves are your shock absorption, if this starts straightening out like this, it starts wearing out. You start seeing spinal decay.
Next, I want to go over your x-rays. In our office, we take x-rays so we can structurally see what's going on. We want to see if there's degeneration present. We want to see how the structure is. We want to see if there's subluxations present. When we look at somebody from the back, we want to see that the spine is nice and straight. We want to see that the hips are balanced in the same height. We want to see the top of the leg bones. We don't want to see this. Can you see the difference? Off to the line, it's putting tremendous strain on there. It's compromising the nervous system. When we look at the neck from the side, this is somebody looking to the left. We want to see a nice curve in there. The curve, if it's maintained, should not show signs of wear or tear for 80 to 120 years. The top bone should be at 31 degrees. You should have a nice 42-degree arc, and the head should be right on top of the shoulders, just like this. The problem is if it's subluxated long enough, it can lead into phase 1, and you can see how this neck's getting stretched out. It's straight. The good news is it's completely reversible. It just takes time. It takes 3 to 18 months to correct. It's kind of like building blocks. Each adjustment adds in the last. If that's left go, phase 1 can progress right into phase 2, and you can see that the disc can start rotting out, start wearing out, and your body will start throwing extra bone down and bone spurs, and it can start spreading. The goal is we got to stop this degeneration from progressing, and if that's left go, it can progress right into phase 3 where it's permanent. And the goal now is we want to increase nerve flow, stop degeneration, but most importantly, with all these, our goal is to increase quality of life so you can live the most fulfilled life that God designed you to live. We check kids in here as soon as they're born Studies show that a normal delivery can put up to 90 to 120 pounds of pressure on a child's head to bring him into this world. In cesareans, they even use more pressure. I want to show you Paisley's first adjustment at 3 weeks old and how easy and gentle it is to get a baby adjusted.
All right, guys, it's first adjustment. This is Paisley. She's 3 weeks, is that correct?
3 weeks.
Congratulations, Brad and Leanne. We're getting her first adjustment today. So if I can have you just hold her against yourself like she's straight up, make sure you support her head. And I'm going to check out her sacrum first. Good job. And I'm going to check her very top part here. You can just slide your hand down a little bit. Just seeing if it's moving well. There it was. You did great, Paisley. Congratulations. We got the power on. Awesome. Come over here and get her eyes. Her eyes opened up. They look a little sleepy, though, but they opened, didn't they? Awesome. Congratulations to both of you.
Thank you.
Thanks.
Good job.
One of the biggest reasons we check children is Dr. Gottfried Gutmann, medical doctor, found that 80% of children are subluxated at birth. And in my 20 years of being a chiropractor, I've personally seen that kids that are getting adjusted regularly are sick less, they're on less medications, they function better, they're able to handle stress better, and they do better at school. So get your children checked. Tara walked in our office when she was 28, and this was her x-ray. You can see it's a complete reversal, it's a wreck. She suffered with neck pain, sinus pressure headaches. She had major digestion problems. After 4 months of care in our office, we took another x-ray, and you can see her spine is up to 34 degrees, but more importantly than that, her symptoms are gone. This is why people drive so far to see us, is because we have advanced training in correcting the spine, which most chiropractors do not study. When Pam came in our office, she said she was living on pain pills, she had injections, she tried physical therapy, but nothing was lasting. Now her life has changed. She said she feels her neck and back pain are gone. Her old attitude has changed. She's eating better. And she said the most amazing thing is her blood work is the best result she's ever had after 6 months of care. Karen came in and we took an x-ray and you can see she's a reverse neck curve. She said she suffered from headaches since she was 8 years old. Then they turned into debilitating migraines, which the only thing she could take was medications for. Now her post x-ray is up to 27 degrees, and she's been maintaining her spine and health for over 15 years in her office.
Hi, my name's Casey, and I grew up suffering with asthma throughout childhood and into my early adult years. I always had bronchitis and pleurisy, all kinds of lung infections, and I never went anywhere without my albuterol pump. When I met my husband, Dr. Brouse, he kept telling me he could help me with my asthma as a chiropractor, and I just thought that that was the dumbest thing I ever heard of. But he took the time to sit me down and tell me about how the body works, like what he's doing with you today. And ever since then, I have not needed my asthma medications in about 17 years.
If you're a candidate for decompression therapy, I want to go over exactly how this works. The goal is we want to rehydrate, bring fluid back in those discs. We want to suck that disc back in. MRIs, you can see the one on the left is normal, nice flow, and the compressed is getting all choked off. That's from a disc herniation or disc bulge, and it destroys life flow. Decompression is a great alternative to help somebody get pressure back off those discs. If you have leg pain, you got sciatic, you got numbness, tingling in your arms or legs, you got lower back pain or neck pain, decompression is absolutely amazing. Many times patients will fall asleep on it. It's very relaxing, and it just stretches everything out and starts healing those bad areas. As far as your care in this office, our goal is that you get results that last. So many times I hear patients come in and they said they went to a chiropractor, they got adjusted, they felt a little better at the problem, keep coming back. Our goal is to get in there and start fixing the problem. We're going to have specific therapies for you to do when you come in. You're going to go ahead and get a corrective adjustment. We'll give you stuff to do at home also, so when you're not in here, our goal is that we can take extras of you 3 to 6 months down the road and see results. Your visits in here should be less than 15 minutes. It's so simple. We want to truly transform your life and your health. I never realized how fast your spine can start rotting out if you don't take care of it until Patty walked into my office. She came in with a whole handful of x-rays and MRIs, and I want to show you the first x-ray she handed me. When she was 41 years old, this is her lower back, and it looks in great shape. The discs look even, spaces are nice. Well, 5 years later, it progressed right into phase 2. And you can see how the discs start wearing out. You can see the ugly bone spurs on there. And with that, her health started declining. The only answer they had for her was medications, and she even went to a chiropractor. They adjusted a couple times, but never tried to fix anything. Well, 2 years after that, you can see her x-ray progressed right into phase 3, and the pressure in the nerve was severe. They actually wanted to do surgery. Medical doctors had her on 13 different medications. Your spine can't wait. It's not like your teeth where you can replace them. Your spine cannot be replaced. So one of the things I want to ask is, how do you picture your future? Do you see yourself out there playing with your grandkids having fun? Or do you see yourself being pushed around with your grandkids living in a wheelchair? You see, you have two options in their office here. First one is you can correct your spine and health problems and take control of your health. Or two, you can get short-term relief and continue down the same path. Both of these choices will take time and money. But I will tell you, if you don't take care of it now, what's it going to take more of down the road? More time and more money. In our office, we make care very affordable, so regardless if you have insurance or you don't, everybody in our office should be able to get the care they need.
In a minute, I'm going to come in and we're going to review all your findings. We're going to go over your x-rays if we took them and go over a specific plan of action to get the results you're looking for.